Okay. Hello, I'm
Hello.
Dr. Sadma. I'm one of the doctors here. Um, am I talking to Mr. Ahmed?
Yes, doctor.
Okay, and are you 32 years old?
Yes, doctor.
Okay, I will talk to you and examine you, and hopefully we will solution to your problem. Is it all right?
Yes, doctor.
Okay, can you please tell me what brings you here today?
Doctor, actually, I'm passing too many waters for last 1 month, and it is causing too many problems in my life now. I'm unable to go to my work. I'm unable to sit normally anywhere.
Uh, I'm very
It's
sorry
so
for your
embarrassing for
problems.
me.
Okay. Uh, I'm very sorry for our problems. I think we will, after the talking, we will come up with a solution. So, can you please tell me how many times you are going to the washroom to open your bladder, to urinate?
It's really, doctor, too much. Every 30 minutes, every 1 hour, I need to rush to the washroom to pass water.
Okay, okay. And how did it start it? Can you please tell me?
It started all of a sudden. I don't know how it started. I was thinking that
Oh,
I'm drinking too much water, but it seems not the reason.
okay. Okay. So, can you please tell me, is it progressively getting worse and day by day?
Yes, doctor, it is getting more and more every day.
So, regarding your water, passing of water, is there any frothiness you have noticed?
No, doctor.
Any discharge you have noticed?
No.
Okay. Any blood? Have you noticed any blood there?
Uh, no, doctor.
Okay. So, with this problem, do you have any tummy pain,
No,
any tummy distension?
no.
Okay. How about your back passage?
Back this is fine, doctor.
Okay. Apart from this, do you have any known medical condition I should be aware of?
No, doctor, I'm quite healthy person. I'm doing my exercise regularly. I don't have any condition before.
Okay. Do you have any high blood sugar or high blood pressure?
No, no, doctor, not at all.
Okay. So with this problem, can you please tell me, are you getting weak day by day?
Yes, doctor, you're very right. I'm getting now fatigue now, weakness. I'm unable to, cope my daily activities because of this weakness.
Okay. So I'm very sorry for problem. Can you please tell me, is the weakness persist throughout the day or in a particular period of time, a particular time of the day you are feeling more weak?
No, doctor, it's throughout the day. I think it's related to my, waterworks. When I'm passing too
Oh,
many water, then I'm feeling myself, fatigued. Otherwise, it's not that the case.
okay. Have you noticed that have you lost any weight recently?
No.
Or do you have to drink too much water?
Oh, usually, yes, I pass more water, so I need to drink more water to keep myself hydrated.
So you feel more thirsty than before, right?
No.
Okay. Do you have any problem while you are standing from sitting position? Do you feel any dizziness?
No, doctor.
No. Do you have any problem with your vision? Any problem?
No.
Any pins and needle type of sensation anywhere in your body?
No, doctor.
So can you tell me, apart from this, is there anything you would like to add? You are facing any kind of problem?
Doctor, I don't know what's going on with me. I don't have any problem in the past. Despite this problem, I don't have any problem. Uh, I don't remember even.
Okay. Do you have any pain anywhere? Like any bone pain, any joint pain?
No.
No joint pain. Okay.
But
So
sometimes
do you have
sometimes I feel that my joints are especially in the hands. There is some pain, but
Yeah.
not all the time, especially knee joint also.
Okay. For how many days you are suffering from this joint?
I think with the same time of 1 month.
1 month. Okay. Do you feel any morning jamminess? Like the pain is more when you get up from the bed.
No, doctor.
No. Does the pain improve with rest?
It's all the time there, doctor. Actually,
Is all the time. Is there any swelling around the joint?
no, I didn't notice.
Okay. So I need to know more about your problems. Like, do you have any chest pain,
No, no chest pain.
any headache,
No,
and have you recently got any trauma to anywhere, like in the head or in the joints?
no, doctor.
Mm. Anyone in your family member suffering from similar kind of disease?
Not similar condition, but my father is
Okay.
having diabetes and mother is having some thyroid issues.
Mm. Okay. So, do you have any preference to any weather? Like, you are preferring hot or cold weather or anything?
No, no, doctor.
Okay. So, apart from this, have you noticed that are you getting calorie day by day?
No,
No. Have you anyone noticed that you have any yellowish discoloration of your skin or your eye?
no, doctor.
Okay. So, I need to know more about your personal habits. Like, do you smoke?
Yes, doctor. Occasional, I'm smoker. Yes, you're right.
Okay. How many sticks for how many days?
6 to 8 cigarettes per day, doctor, for last 5 years.
Okay. You know that any kind of smoking is very injurious to our health, actually. So I will have to refer to the smoking cessation clinic for that. Is it all right for you?
Thank you, doctor.
Okay. Do you drink?
No.
So I need to know, is there any rashes anywhere in your body?
Yes, doctor. I have a rash. Yes, you're right.
In
I have rash in my legs. Yes, you're right.
legs. Okay. And it is for last how many days?
For how many days I don't remember exactly, but there is a rash.
Okay.
Yes.
Okay. Is it painful?
Sometimes, yes, doctor.
Sometimes. Is it itchy?
No, not itchy.
Is there any oozing or bleeding from the rash?
No.
Okay. So do you have any grittiness in your eye?
No.
Any redness or any problem in your eye? Like any itching sensation or any redness?
Sometimes there is redness.
Sometimes. Any soreness in your mouth?
No.
Any soreness in your private part?
No.
Okay. May I examine you?
Yes, you can examine, doctor.
Okay. At first, I want to check the hand. Is there any clubbing or is there any anemia or cholionicia?
No. No. In the
How,
hand, there is no prick marks, no
okay.
chylomicria, no clubbing.
Okay. Is there any rashes in your head? I need to see.
Rash on?
And hand.
No, 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 no rash.
Okay. Any swelling in the hand joint?
No.
Okay. I need to see the functional status. If he can hold a pen.
No. The function is intact.
Okay. Then I have to check the eye. Is there any redness or anything present?
Yes, there is a redness.
Redness present. Okay. I need to check the mouth. Is there any oral soreness present?
No.
Okay. I need to check the yeah chest. Is there any crypts or any bronchial breathing or the breath sound and the air
There are
sound?
crabs.
Is there anything? There are few crypts.
There are
Okay.
few crabs.
Okay. Okay. I need to see the tummy. Is there any tummy pain or anything in the tummy? Any abdominal swelling or any organomegaly?
No organomegaly, no swelling.
Okay. I need to check. I need to wear the gloves and check the rash.
You can see the rash. Rash is reddish spots, anterior shin,
Okay.
present on the anterior shins. Please
Okay.
mute yourself.
Okay. Okay.
Okay.
Is there anything uh other than the rash? Is there anything present in the leg, like leg
No.
swelling or anything? Nothing.
Mild
Okay.
redness along with the mild swelling. Otherwise, nothing.
Milestone. Okay. 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 So I need to know. I need to talk to you more about. Do you drive?
Sorry.
Do you drive?
Yes, doctor. I drive.
Okay. Do you have any problem regarding driving because you have some hand pains?
Sometimes I feel that it's difficult for me to drive to go to work.
Oh, okay, okay. What do you do for a living?
I'm a IT technician.
Technician. How this problem is affecting your life?
You are very good, doctor. Actually, I'm suffering too much, doctor. I'm missing my job nowadays, and whenever I'm on my seat, I need to go every 30 minutes to pass my waterworks, and so embarrassing. I told you before, so that's why now I'm most of the time I'm staying at home.
Okay, okay. So I'm very sorry for the problem. I will refer you to the occupational health specialist for this, and I hope they will come up with a solution for the problem. With
Thank you.
whom do you live?
I live with my wife and two children.
Okay. So do you need any social support?
No, doctor. My wife is at home and she's a housewife and she's helping me a lot.
Okay, okay. So I also need to check if this patient has any dehydration and check is there any postural hypotension.
No postal drop at the moment.
Okay, okay. What is your concern?
Doctor, what's going on with me? I'm too much tired now to think about that. What's going on with me? I have visited too many times to the GP, but I don't know. Please tell me what's going on with me.
Okay, based on your problem, I have heard and I have examined you. I think you are suffering from a problem it named sarcoidosis. Don't bother about the term. Actually, in this condition, there are some problems in our body, and that causing too much calcium in our body, and that's the reason you are suffering from more and passing more and more urine nowadays. Any other concern?
Doctor, is it a curable condition?
Actually, with the management, medical management, I think it is curable and you will lead a nearly normal life.
So,
Any other concern?
yes, doctor, will I pass 2 minutes left? Will I pass this condition to my children also?
Actually, there is no direct relation that the children will have the disease from the father. Uh, but actually, we cannot tell that the children will never suffer from it. But this is not a genetic problem.
Okay. So, doctor, you are going to
And
admit me now.
actually, after examining you, I think uh, for now you don't need to get admitted. I will give you some test, and you after seeing that report of the test, I think I will give you some. We will form a multidisciplinary team to treat you, and after that, giving you, I will give you some medication and medicine, and after that, I hope you will lead a normal.
Okay.
Any other concern, Mr. Ahmed?
Doctor, is it a cancer? Because I have a cough also, and and my
Actually, this is not a cancer. This is some inflammation, we can say. The body have some inflammation, and this happens in different part of the body. This is not a cancer.
okay.
Any other concern, Mr. Ahmed?
Thank you, doctor. Thank you.
Thank you. Thank you. Thank you.
Thank you. So, you have 20 seconds more, but you can present your case, Dr. Sadman.
Okay. Based on the history and investigation, I think the patient is suffering from sarcoidosis, and the problem is having polyuria. I think this is because of hypercalcemia, which is a
Mhm.
common manifestation of sarcoidosis.
Okay.
Regarding the positive sign, I have found that patient has some inflammation in the eye. You can say uveitis. Also, patient has some lumps in the leg. That means patient has erythema nodosum.
Okay.
Also, patient has symptoms of hypercalcemia, and
Okay.
these are the positive findings. Yeah.
So, what's your differential diagnosis, Dr. Sadman, in this case?
Uh, Actually, although he doesn't have any weight loss or anything in particular, uh, regarding hypercalcemia, as the patient is suffering from hypercalcemia, I think there can be some occult malignancy. Although I haven't found any positive features for malignancy, but hypercalcemia we should warrant for any malignant screening if we don't find any cause. Secondarily, as this patient is hypercalcemia, this can be a case of primary hyperparathyroidism. Although the erythema nodosum and uveitis is a negative point for hyperparathyroidism.
Okay. Okay. So, how you will investigate this case, Dr. Sadam?
Uh, Actually, I need to I need some basic investigation like CBC, urine electrolytes. I see I need some liver function test. Also, I need to see the serum calcium phosphate, and to rule out the DD, I have to see the serum parathyroid level. Also, I need to see the chest X-ray. Is there any bilateral hilar lymphadenopathy present or not? And also serum ACE level. We can also do serum ACE level. If we find any say bilateral hilar lymphadenopathy to see the extent of sarcoidosis and to see the staging of sarcoidosis, I want to do the HRCT scan of the chest.
Okay. So, how you will manage this case? Your time really up,
Uh,
but you have 2 minutes more.
okay.
How you will manage this case?
Uh, Actually, in case of if the patient is suffering from, if we see any severe hypercalcemia after seeing the calcium level, we have to we have to admit the patient and give the IV so they are normal saline. And if the patient and regarding sarcoidosis, we can is if the stage is 1 or 2, we can give supportive management, and if the stage is 3 or 4, we can give steroids.
Very well. Anything else you want to add in this management plan?
And also, in case of we have to take care of his eye to be any topical ointment or topical eye drop for any bleeding sensation of the eye, and we can give topical moisturizer in the skin to reduce his uncomfortability.
Okay. Thank you, Dr. Sadman. Very well done. You have picked up the diagnosis very well. Uh, what do you think about your performance?
I don't know if you can tell. I'm not sure.
So you picked up your diagnosis very nicely, and physical examination you did very well regarding the skill A. Physical science, there are few things actually. Physical examination regarding there are few things are missing. We will discuss about that later. Physical sign you have picked up. Communication skills were good, and but there are few things need to be well elaborated in this case when you are dealing with the polyuria. You didn't rule out very important causes here, which should be there. Differential diagnosis was good,
Huh?
and I
Correct.
was expecting some other differential diagnosis from you also, like sarcoidosis, diabetes insipidus or diabetes mellitus. Okay, and the local problems, especially because it's a primary organ is a genitourinary. You can put their differential diagnosis. Clinical judgment was good, so you were touching everything: driving, job, and his personal life, social life. That was very good. But one thing I want to mention over here: when someone is smoking, you can
Yes.
ask. I highly appreciate your concern that smoking is injurious to health. If you want, then I can refer you to the smoking cessation clinic. You cannot say directly, I'm going to refer you. Okay.
Okay, okay.
Clinical judgment was good, and managing patient's concern skill F. You did very well, and patient welfare was good. So overall, you did very well, very well. So
Thank you.
is there anything anyone want to add in this in Dr. Sadman's presentation or his skills? Is anyone from the audience need to add anything in his performance today's? If not, then we will move to how to approach this polyuria. Okay. So how to approach this polyuria? It's a huge topic, but we can make it very easy with our approach. I'm going to share with all of you how to approach a polyuria. Can you see this picture, everyone? Dr. Sadman, hello. Is
Yes, yes,
anyone
I'm
can?
seeing this.
Yes, yes. This is a
Yes,
polyuria.
it's
This is
visible.
yes. This is when you are dealing with the polyuria, your first job is to rule out the local causes. You have to establish, is it a pseudo or true polyuria? How you can differentiate the pseudo from the true polyuria? Pseudo polyuria means frequency, amount, color, and blood consistency, and the timings. So you need to ask burning micturition, soreness in your passing urine, blood, frothy urine, any flank pains, any stone you are passing. If this is the case, it means it's a pseudo polyuria. So causes will be UTI, BPH, and overactive bladder. If you have ruled out, the most likely case will be discussed in PACES exam. It will become to as a true polyuria. If it's absent, then you will move to the three most common causes of polyuria. Okay, just keep three things in your mind: diabetes mellitus, type 1 and type 2, diabetes insipidus, central and nephrogenic, and primary polydipsia. So primary polydipsia, you need to establish any past history of psychiatric illness, depression, anxiety. If the surrogate is not doing anything, then diabetes insipidus come to the central. Dr. Sadman, what was missing in your history? You just asked about the trauma. You didn't ask about any recent infection. You need to, thoroughly scan your CNS questions. High body temperature, neck stiffness, headache, involuntary movements, loss of consciousness, mood changes, eye problem, vision problem, difficulty in speech, difficulty in swallowing, weakness, any part of the body, sensory symptoms, difficulty in passing urine, or water works or bowel works. So these are the screening questions from the CNS side. Trauma, TB, tumor, you already explored that. So then come to the nephrogenic. Nephrogenic, you need to ask about the drugs, especially lithium and diuretics. Calcium, calcium need two, three, four questions. You have to, touch here men type 2, cancers, multiple myeloma like, and sarcoidosis. And the familial, sometimes you have a nephrogenic DI familial variants. There are two or three variants of familial. So in this way, you can reach your final diagnosis because you don't have time in your basis exam. Just follow this short scheme. This is a very concise, a very effective scheme. If you are ruling out your DDs according to this format, you will reach your diagnosis very early. So coming to the next point, whenever you rule out the local associations and general association according to this picture, come to the general questions: weight changes, anorexia, fever, fatigue, itching, rash. You did very well. You asked about the rash, then sleep, snore, and sweating. Then come to the social history. You did very well. You asked covered almost all the aspects of the social history. Coming to the examination, of this patient with the polyuria. So, as we have three most important organs involved in our body, so we need to at least screen that in our physical examination. We don't have actually in PACES exam, we need to move very fast. If you don't have any scheme in our mind, so we will see sit there and we will see the surrogate and patient and examiner. So starting from the head, you need to see the clubbing prick marks because of diabetes, BP, offer postal drop there. Then neck, examine the thyroid, just swallowing movements and palpate. Come to the eye, H-shaped movements, visual acuity, and offer fundoscopy there. If there is something in the brain, you need to, whenever the CNS involved, you have to do the fundoscopy. At least you need to, I will explain later fact. Okay. So you need to offer at least fundoscopy when there is a brain involvement. So polyuria, three differential diagnosis, diabetes mellitus, diabetes insipidus, there is a central cause. So you need to do the eye examination. Then you will offer fundoscopy. Then come to the mouth ulcers. Then also check here pronated drift. If there is any CNS pathology you are suspecting, come to the abdomen, visceromegaly, and palpate the bladder and kidneys. And see is there if there is any mass and offer digital rectal examination for the palpation of any nodular mass in the prostate. So don't forget to auscultate chest over here. When you finish your examination, come to the investigation part. Dr. Sadman almost mentioned everything there. General investigations, CBC, RFTs, liver function, serum electrolytes, calcium, phosphate, PTH, CRP, urine analysis, urine culture if needed, urine osmolarity, okay, urine and blood osmolarity, then specific ANA, RA factors, then so these are investigation we can offer. Sorry, urine examination, ultrasound abdomen, if indicated, then the CT abdomen, MRI brain, urine and serum osmolarity, and you can offer here water deprivation test.
पढ़ने तो
And
बंद
if
में खोद दे ऐसे नहीं गए थे बैग किताब
please, doctor, I will mute you. I'm going to mute. Yes. So urine osmolarity, serum osmolarity, water deprivation test, and for the localization, you have to do the vasopressin test, DD-AVP test. So in this way, you can localize the lesion and you will investigate regarding the treatment. Dr. Sadwan, in PACES exam, they love too much. If you are, just a second. Sorry. So regarding the investigation or management plan, when you are going to face the examiner, whenever he's asking about the investigation, just mention 3 lines. If the examiner will ask you further, he will probe you, then you will speak out, otherwise no need. Sir, I would like to investigate him to diagnose my case, to look for the severity of the disease and look for the complications. This must be the first paragraph when you are describing your investigation plan. If he will ask you further, then move further. Sir, starting from the baseline, then go to the specific tests. Management plan, there are 2 management plan in PACES exam, always, and always. General management and specific management. Education, counseling, disease explanation, lifestyle modification, and social work, social support, and occupational support, life dietary modifications, okay, and maintain the diary of this intake output in this case. Specific management according to the cause, especially in this case, if the cause is sarcoidosis and he is suffering with this condition, so he will involve the chest specialist. Need to mention here chest doctor, lung doctor, especially, sorry, lung doctor, and a gland doctor, and also a kidney doctor. This is a multidisciplinary team, or they will give him a management plan. This is what in we just need to mention in front of the examiners. If they will ask you something else, then you will add, otherwise no need. because no time there, no need to go in the details. Just superficially, you will touch every aspect of this scenario, and you will be in the safe zone, and you can get a maximum score in this case. So from my side, I have finished this case. Is there any question from audience and any doctor? I will be very happy to answer.
What is fact?
Facts, frequency, amount, color, consistency, and timings. So frequency, very important there. Sometimes pseudo patient is going too much times to pass the urine, but the amount is too small. So our polyuria definition is more than 3 liter per day. If he is going 10 times or 20 times, but he is passing 5 ml or 10 ml every time, so it will not, reflect as a polyuria. It's an increased frequency. So frequency, amount, color, consistency, and timing. At what time he is passing more urine. You can rule out diabetes here, infections here, stones here, if there is a frothy urine or any blood. Doctor, did you get your answer? Any other question from anyone? So this approach is understandable to everyone, I think.
Sir, what will be the difference in approach doing FCPS in the case of polyuria and MRCP cases?
Actually, honestly speaking, there is no difference in approaching any case FCPS or MRCP. The difference is only the examiner's attitude and the history of the patient is too long there. You need to touch every aspect. In PACES exam, Dr. Sadman's performance was accurate according to the PACES, because he is having certain different parameters, different skills. He have touched every skill, so he can pass this case. But in FCPS, they need to catch you at any step. But approach will remain similar. There is no change. So I hope this approach is very easy and digestible, right?
Yes.
So if there is no question, doctor, then I'm going to end this meeting, and we will see you very soon, inshallah. And we will arrange another long clinical consultation. Dr. Sadman, thank you so much for joining us today, and all of you, thank you so much.
Thank you, sir.
Thank you, brother.
Okay, I'm going to end this meeting. Assalamu alaikum.